There are a couple of very useful and important acupressure points here. One of them is Gallbladder 34, which is a very good point for influencing the whole of the side of the body into the hip, the sides all the way up and into the head, the sides of the head. And the other one is stomach 36, which is a classic point for energy. And finding them can be tricky, but I've got a good method for you. So the first thing is to find the patella or the kneecap, which I've got there between my fingers. I can feel it and I'm moving it around. Once I've found that, I can find the lower border and come round to the side. And then I just come down about an inch and feel here for a bone. There it is. So I found, first of all, I came round to the back, bottom, came down, and I found a bone. If I put my finger on that bone, and I can then come up the leg here, and I'm running up the edge of another bone. So this big bone here that I'm running up the edge of is called the tibia. And this lump that I'm feeling here is the head of the fibula. It's a little small bone. So there are those two reference points, running up the edge of this bone and feeling the head of that bone. Now all I've got to do, if I look at that angle, it's about 45 degrees between these 2 points I'm touching. All I've got to do really is that and that. And this will be my gallbladder 34 and my stomach 36. There are my 2 points. So if, for example, I want to do a lot of work on helping someone's hip or side of their head, even where the gallbladder meridian runs, you'll be able to look this up on diagram. Then I'll come in and I'll be doing some nice strong massage on that gallbladder 34 point. If I'm more working on digestive function and possibly on the flow of the stomach meridian, which is into the abdomen and into the tummy, then I'm going to be working on stomach 36. But these are points that come up quite often, and gallbladder 34 is also going to be a useful point when we do our relaxation protocol at the end. This is the knee joint. Normally, obviously, things would be closer than this, and this is the patella, the kneecap. When we're locating stomach 36 and gallbladder 34, these two useful points which are close to each other here, we find the lower border of the patella and we come round to the side, and that will be where we are. The lower border of the patella will line up with this gap between these two bones. Then we come down an inch and we feel that. That's what I'm talking about when I'm talking about the head of the fibula. We feel this bone about an inch. So bottom of the patella, move round, come down an inch, and you'll feel that bone. Now in front of it there is gallbladder, and in front of it there is stomach 36. So you have these 2 points there and there. There's a 45-degree angle running like that. Gallbladder, stomach. There are those 2 points in relation to the bones.